As you know, it's important to me that the supplements I recommend and use are of the highest quality. That's why I stock the Protocol for Life Balance product line at my online dispensary, drhoffman.com/Protocol for Life Balance. Protocol for Life Balance offers a wide range of professional-grade products using ingredients backed by strong scientific research, including a suite of supplements specifically designed to support neurological health and cognition: Coggumin SLCP, Magtine, phosphatidylserine, and Brain Regain. Coggumin SLPC is curcumin optimized to penetrate the blood-brain barrier, where it helps protect brain tissue. Magtine may support healthy cognitive function, learning, and memory. Phosphatidylserine supports neuronal membrane fluidity, promoting cognitive function and mental acuity. And Brain Regain is a broadly useful herbal health aid that may be advantageous for supporting healthy cognitive performance. For more information and to order, just go to drhoffman.com/Protocol for Life Balance. That's drhoffman.com/Protocol for Life Balance. Protocol for Life Balance is an A-rated GMP manufacturer of premium dietary supplements.
Welcome to Leyla Weighs In, here on the Intelligent Medicine Podcast. Thanks for downloading these podcasts. We're so happy to bring you compelling information, take your questions. If you'd like to email any questions to me that you'd like to hear me weigh in on, or a topic of interest that you'd like to hear me discuss or give you my opinion on, the email is questions@drhoffman.net, questions@drhoffman.net. There's a wonderful journal I enjoy. It's called Alternative Therapies in Health and Medicine. And this was just released last month in January about brain cancer and how a simple supplement mix shows remarkable results in brain cancer. Most cancer treatments, including chemotherapy, radiation, radiotherapy, immunotherapy, these are designed to attack and destroy cancer cells. And a growing group of researchers is now asking whether this long-standing approach may be missing something important. What if the real path to a cure isn't to damage cancer, but to coax it into healing instead? I'm so glad that researchers are asking this question, because we've known for decades the very, very real side effects of chemotherapy, of radiation, of certain immunotherapies. I'm just so happy that they're thinking differently about it, or thinking outside the box, that they're asking, what if the real path to a cure is not to damage cancer, but to coax it into healing instead? So this provocative idea is at the heart of work led by researchers at the Advanced Center for Treatment, Research and Education in Cancer in Mumbai, India. The concept isn't completely new. In 1986, an article in the New Journal of Medicine by Dr. Harold Dvorak suggested that cancer behaves very much like a wound that never heals. Cancer and chronic wounds, they share many biological features. And the Indian researchers from Mumbai argue that rather than always trying to destroy tumors, medicine should explore ways to help them move towards a healed, less aggressive state. In a recent study involving people with glioblastoma, which is one of the most feared brain cancers, this team reports that a simple combination of 2 low-cost nutraceuticals appears to support exactly this kind of healing process. So they're testing a gentle strategy in glioblastoma. Glioblastoma is a fast-growing, highly aggressive brain tumor. Even with modern treatments, such as surgery, chemotherapy, radiotherapy, used alone or together, patients typically survive a median of only about 15 months. Very, very poor outcome. Now, in the new study published in BJC Reports, Professor Mitra and colleagues enrolled 10 patients with glioblastoma and asked them to take a tablet containing small amounts of 2 nutraceuticals, and those are resveratrol and copper. They took this tablet 4 times a day for an average of 11.6 days before their scheduled brain surgery. This is 10 patients that were told to take a tablet containing resveratrol and copper 4 times a day for an average of 11.6 days before. Another group of 10 patients whose tumors were similarly aggressive, but who did not receive resveratrol and copper, they served as the control group. Now, during surgery, the team collected brain tumor samples from both groups. These samples were then examined in detail using microscopy, immune staining, other things, to see how the tumors differed. They really did a full analysis of the tumors to see how they differed. The analysis showed that the nutraceutical tablets had a striking effect on tumor biology. There were dramatic changes inside the tumors. Several key cancer markers shifted in a favorable direction in patients who received the resveratrol and copper tablets. Average levels of a particular protein called Ki-67, this particular protein is a widely used indicator of how quickly glioblastoma cells are dividing. We're almost 1/3 lower in treated tumors than in untreated ones. This suggests the cancer was growing less aggressively. Now, biomarkers associated with 9 major hallmarks of cancer were present in 57% fewer cells in the treated samples. Levels of 6 immune checkpoints, proteins that normally prevent the immune system from attacking cancer cells, were on average 41% lower in the treated tumors. And 3 markers linked to stem cells, which may help tumors spread and resist treatment, were 56% lower in the treatment group. Crucially, the patients who took the nutraceutical tablets did not experience any side effects. I mean, think of it. Those of you taking things like resveratrol, copper, you're not experiencing any side effects. Neither did these patients who underwent this study. Dr. Mitra says these results suggest that a simple, inexpensive, and non-toxic nutraceutical tablet potentially has the power to heal glioblastoma. Let's talk about the rest of this. So, how might this apparent healing happen on the cellular level? According to Professor Mitra, the key activation involves resveratrol and copper acting on cell-free chromatin particles that circulate in the body. These are fragments of DNA released from dying cancer cells that can worsen the behavior of surviving cancer cells. Earlier work from this group showed that when resveratrol and copper are combined, they generate oxygen radicals that deactivate or destroy these chromatin particles, these cell-free chromatin particles. In the current study, the researchers found that these cell-free chromatin particles were abundant in tissue taken from untreated tumors, but were almost completely absent from tissue taken from tumors in the patients who had received the nutraceutical tablets, the treatment group. The findings suggest that dead cancer cells in the treated group were removed through apoptosis. That's a controlled cell death process before they could release these cell-free chromatin particles into the surrounding environment. So, Professor Mitra explains, the cell-free chromatin particles, fragments of DNA released by dying cancer cells, they inflame the surviving cancer cells, and this makes the disease more aggressive. Quote, if you eliminate the cell-free chromatin, which is what the resveratrol copper tablets do, the cancer is subdued. He adds that with longer-term use, this approach might possibly lead to complete healing of the cancer, effectively turning a malignant tumor into a benign one. This makes you kind of gasp in awe of what they're finding. One of the most notable findings from this study is that the resveratrol copper tablets reduced the activity of several immune checkpoints. Immune checkpoint inhibition has been hailed as a breakthrough in cancer therapy because blocking these proteins can unleash the immune system against tumors. However, current immune checkpoint inhibitor drugs are extremely expensive and can cause significant side effects. Who needs that, right? In contrast, the nutraceutical combination used in the study is simple, it's non-toxic, and inexpensive, yet still appears to downregulate multiple immune checkpoints. This raises the possibility of a more accessible way to influence some of the same pathways targeted by costly cancer drugs. So, a new approach to treating cancer has begun to emerge from these observations. Professor Mitra says, we've been trying to kill cancer cells for 2,500 years, since the time of the ancient Greeks, without success. Quote, maybe it is time to look at cancer treatment differently and work towards healing tumors rather than annihilating them, rather than a full-blown assault, which also assaults the patient when you think about many of these therapies and their horrendous side effects. I'm talking about chemotherapy, radiation therapy, even many immunotherapies. The immunotherapies thankfully have less side effects than chemo and radiation. But again, just looking, rather than annihilating the tumor, looking towards healing a tumor. Now, Professor Mitra does say, of course, the number of patients in this study was rather small. However, the results were so striking that I'd fully expect them to be replicated in a larger sample of patients. Quote, I believe that we may be on the brink of transforming the way cancer is treated. If you want to know more about this, Professor Mitra is the Dr. Ernest Borges Chair in Translational Research and Professor Emeritus in the Department of Surgical Oncology at the Advanced Center for Treatment, Research, and Education in Cancer. ACTREC is the acronym, ACTREC, at Tata Memorial Center in Mumbai. And the study was supported by the Department of Atomic Energy, Government of India, through its grant to the Tata Memorial Center, awarded to Dr. Mitra. This is fascinating and so encouraging, and something to look forward to as more and more researchers are looking in this direction, looking at healing a cancer rather than annihilating it, because it's also annihilating the person with cancer, which often leads to horrendous side effects. You all well know, because at this point, all of us know at least one person with cancer who are undergoing these treatments, which are, have been used for decades and decades, with very small successful outcomes. Really not a success at all in cancer therapy, in my opinion, right? Or not without great expense to the patient in other things. They may come down with other illnesses that would eventually take them down. And especially where it includes immune dysfunction, because so many of these treatments cause dysfunctions in immunity. That's how they work. And this is a problem, as we know. So I'm really buoyed that more and more researchers, and I hope more and more researchers in our country, in America, in the United States, are shifting away from always a pharmaceutical, but more of what can the nutraceuticals do in terms of healing, right? Without any kind of side effects are attached to so many non-natural pharmaceuticals. Think about it. We want to help the body to heal itself. We want to help the body to heal the cancer. Indeed, that's what we're looking to do. That way, the patient is spared the downstream effects of so many toxic therapies that really dysregulate the immune system and cause other problems. They may heal this one particular cancer, but cause another cancer down the road because the immune system has been suppressed or disabled or some other kind of bodily insult to the patient, which sets them up to suffer and perish from another serious disease. This is not a cure. And therefore, we need to start thinking, researchers need to start thinking outside of the box. And I'm really thrilled. And this is alternativetherapies.com, alternative therapies in health and medicine. This was released in January 2026. This research that came out of the Advanced Center for Treatment, Research and Education in Cancer in Mumbai, India. If you want to take a look at it yourself. I want to thank you for joining me on another edition of Leyla Weighs In. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.